Well, there are some new concerns about medical gender treatments for minors when it comes to puberty blockers. The news comes as a health review board in England is now limiting medications due to a lack of evidence of their benefits and concern about long-term health. Here in the U.S., 22 states have banned gender treatments. Investigative correspondent Rich McHugh is following this story, joins us live. So, Rich, what evidence does this new review cite?
Hi, Nichole. So this is it's a bombshell report. I'm just going to say it. It comes from Hilary Cass. She is the former president of she's the former president of the Royal College of Pediatricians over in the UK, which is essentially the top dog over there. She was asked to look at all the evidence, and the evidence, what she's found, is really damning and could change the conversation here in the United States on this topic. It goes right at the heart of gender-affirming care. I want to get to what she writes, though. The evidence, she says, despite thousands of vulnerable youths have been given life-altering medications and treatments. Quote, the reality is that we have no good evidence on the long-term outcomes of interventions to manage gender-related distress. She also writes, it has been suggested that hormone treatment reduces the elevated risk of death by suicide in this population, but the evidence found did not support this conclusion. The review, commissioned by England's National Health Service after whistleblowers at the Tavistock Gender Clinic outlined how kids were fast-tracked to medications despite evidence. Marcus Evans, a clinician and governor at that clinic, was one of those whistleblowers. Take a look.
First thing that she says is the whole environment is being toxic and politicized, and that has interfered with people listening to whistleblowers like me. But it's also interfered with her getting evidence for her report. She aims a lot of criticism at what's called the affirmation model. That is the idea that someone comes in with a belief and you should just affirm what they're saying. This is completely antithetical to good mental health practice.
Now, her report challenges gender-affirming care, which we are practicing here in the United States at its core, and the stance that the major American medical groups have taken on the issue. Jamie Reed, who identifies as a queer woman married to a trans man, she blew the whistle on the Pediatric Gender Center at Washington University after working there. This report's conclusions, she says, are critically important and should guide us here in the States. Take a listen.
Puberty blockers are out. Puberty blockers are no longer to be used in pediatric or adolescent populations. The scientific evidence does not support their use. Second, cross-sex hormones should be used on such a limited basis and only in extreme caution. I believe that we have now been given a direct framework from an amazing partner country who utilized their national health system to do systematic reviews of evidence, and they have given us a nonpartisan pathway forward, a way to move forward in our country outside of the partisanship, utilizing the best scientific evidence that is currently available.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.